Okay, hello everybody. So I'm Rebecca Rayner and I'm a Neurosciences clinical lead physiotherapist at the Norfolk and Norwich Hospital, so local to hopefully most of you. And I have a specialist interest in vestibular rehabilitation and vestibular conditions. So I agreed to talk to you today live, which is my first live stream, so hopefully it's going to go okay. But agreed to talk to you today because often the vestibular system is forgotten in falls prevention and rehabilitation. So I thought it was a perfect opportunity to get the word out there about vestibular rehabilitation and the vestibular system itself, and give you some education around what you can do if you think you may have a vestibular problem. So I've drawn you a little picture about balance. I'm not sure how easy it is to see, but hopefully you get the idea that the balance system is made up of three components. So we have our vision, our eyes, our somatosensation, which is the feeling in our feet, all the way up through our legs. And then what we have is these little proprioceptors in our muscles and tendons, and they help us know where our limbs are in space. And then importantly today, our vestibular system. So our vestibular system is found in our inner ear. We have one in each inner ear. It's made up of a peripheral apparatus, and then it links to our brain, our central nervous system, through the vestibular nerve. So again, one on each side. And why it's so important is it helps us detect our position against gravity. It helps us with our head motion. It helps us keep our eyes stable while we're moving. It helps us with our balance control. It helps us when we're accelerating and decelerating. And the vestibular system is often forgotten in balance because we take it for granted. We do with all our balance sensors, but as people get older, they deteriorate. All systems deteriorate. Our vision deteriorates. Our somatosensation, our feeling from neuropathies or just from general aging process. Obviously our strength, which I know you're talking about in different sessions, but also our vestibular system. So you can get just general gradual degeneration of the vestibular system or deconditioning of the vestibular system, where maybe once upon a time we would jump on a trampoline, we would run across the grass, all things that would keep our vestibular system interested and primed. But as you get older, you move slower, you maybe stick to more flat ground, and the vestibular system isn't so interested in them, so it switches off. So part of my talk today is going to be how you help excite and prime a healthy vestibular system to keep it optimum, to help reduce them falls and prevent them falls ever happening. But the other part is going to be looking at vestibular conditions and impairments, and if you have one or think you might have one, how to access help and what you can do to help yourself. So there's several types of vestibular conditions and impairments, but the most common, especially in the elderly, is something called Bppv, so benign paroxysmal positional vertigo. And that is a problem in the peripheral vestibular system, so just inside your inner ears, where some of the crystals that normally are sitting on a receptor bed that help us detect where we are and where our head is in relation to our body, they become loose. So sometimes it might be from a bump to the head, or it might be from a long lie in bed, such as in ITU or a hospital stay, or sometimes it is just from deconditioning that they just gradually rub away, and these crystals come loose and go into the fluid where they're not meant to be, and into an apparatus called a semicircular canal. And we have three of them in different orientations in both ears. So we can do flexion, extension, rotation, and side, and they will pick up all their motions. And what this means is because the crystals have gone into the fluid in the semicircular canal, when we tilt our heads, so for example, getting in and out of bed, rolling in bed, looking up at the sky, maybe at a bird or an aeroplane, or hanging the washing on the line. Sometimes people are triggered at the hairdressers when they're tilting their hair back to have their hair washed. But then positional changes cause a surge down the vestibular nerve, a surge in vertigo. So the room spins or you feel horrendously dizzy. And what we see as clinicians is your eyes spinning, a nystagmus, we call it. And that then means that the crystals are sending that receptor down, but very short-lived, because they're basically moving with gravity as you move your head into a position and then sitting in a place which sends the signal. So typical Bppv symptoms last very, a short amount of time, 30 seconds, a minute really, even less time than that. You might feel groggy, you might feel off balance after it's happened, but the actual surge in vertigo is short-lived and from a position change. And what we find, I often see in clinical practice, is people have had that episode and then thought, oh, I never want that to happen again. So they will put lots of pillows in their bed so they don't lie flat, or they'll only roll to the left or the right, whichever way didn't cause the dizziness. Or they might move really slowly and use their body more and less of their head movement. And so by avoiding then their movements, they're actually worsening the scenario, because the crystals haven't had a chance then to move back. And sometimes with Bppv, it just spontaneously resolves. So actually then you'd be able to do that movement the next time without any symptoms. But also what's good for Bppv, what's really important to know, is it's very easily treatable. So often in GP practices, definitely in ENT clinics, and lots of the time now in physio-led vestibular imbalance clinics, and in the private world of physiotherapy, you can find people that are trained in techniques to diagnose and then treat to get rid of Bppv. And there's a very high success rate from the research and from my own clinical practice. I know that once you've done this maneuver, often that vertigo is fully cleared and the person can get back to moving normally again, do some balance rehabilitation with fully functioning vestibular systems. So it's a good one to know about. So Bppv, there's a lot of good videos on YouTube about it. We're not often, health professionals don't say, don't Google it, don't look on the internet, but actually the Bppv education is very good on YouTube, and how to do an Eppley Maneuver, how to do a Dix Hall pipe to know which ear the problem is in, and some self-treatments. But if you have any worries, always discuss it with your GP or your community or your current physiotherapy team that you're involved with. So another one, Meniere's disease, much less common and is more of a gradual deterioration in our vestibular functioning, causes episodes of vertigo, but they're a bit longer lived. And also hearing loss, tinnitus, associated changes with the whole inner ear, hearing and balance system. Migraine. So in the migraine world, obviously you could typically think of it as headaches, but there's now a lot more research looking into subtypes of migraine, and one of them is vestibular migraine, so where you get dizziness or imbalance episodes as your migraine symptom. Another common one, inflammation of the vestibular nerve, and that's a particular interest for me because working in the acute stroke unit, we can use tests to work out if people are having just an acute inner ear problem or an actual stroke. And so obviously that's brilliant at the front door when you need your treatment straight away. So typically called labyrinthitis or vestibular neuritis. What this means is that one of your inner ear systems will have an inflammation in the nerve, so the peripheral apparatus and the nerve down into the central nervous system. And we said before, there's one in each ear, so they need to work as a pair. And if you've got one working 100% and one working 60 or 80%, it causes an imbalance, which means that you perceive an illusion of vertigo, of dizziness, but also you will be off balance. And I'm sure some of you will have had labyrinthitis before, and I know some of my colleagues have, and we have a lot more empathy now when people come in with them conditions, because it is horrendously challenging at that point in time. Another one that can cause vestibular problems is stroke or neurological conditions, MS, all different varieties of vestibular impairment from what we call central nervous system conditions. And this reason is obviously the vestibular nerve is part of your nervous system. So with an MS, for example, you can get a lesion on that nerve, which will lead you to have imbalance, dizziness, problems associated with the vestibular system, so vertigo. So BPPV, take-home message is very easily treatable and very common in elderly people, and also contributes to falls. So you could imagine, for example, one of my patients, this was a while ago when I worked in London, but kept falling backwards when he put his key in the door. It was a high up lock, and basically he tilted his head backwards as he was doing it. And it didn't all add up. He basically said, when I do that, I feel really off balance, dizzy, don't like the sensation of it. So he started avoiding it, but he'd also had a couple of falls, and one of them quite badly down a couple of steps. And actually, it was BPPV. The trigger of him looking up caused the illusion of dizziness, made him off balance, and caused him to fall. And so by treating that, he didn't have a problem again putting his key in the door. So very simple if you get the right treatment for it. Okay, so moving on, in terms of symptoms that you might find when you've got a vestibular problem. So we talked about vertigo. Vertigo is an umbrella term for dizziness, for the illusion of movement, either you or the room, when actually you're still or the room is still. Reduced balance, so feeling unsteady inside but actually looking quite stable, or actually veering one way and being posturally quite unstable. Staggering, not able to stand with your feet together or in a tightrope position. With dizziness and reduced balance, often people overuse their vision because the brain's clever. It wants to help you adapt to this scenario of one inner ear not functioning properly or both inner ears not functioning properly. And it then says, oh, I'm not going to use that vestibular system. I'm going to use my vision. So you've got your feeling in your feet and your proprioceptors we talked about, and you've got your vision. And that can do quite well when you're walking along out on the paths in your house with your eyes open in well-lit environments where everything's quite still. But what happens if you're not using your vestibular system properly is when you head then out into crowds or supermarkets or on an uneven ground, such as the grass or sand or pebbles, or you move quickly or turn to look at someone, then your vestibular system's needed, and it's been so deconditioned or switched off because of the impairment, your vision is then not reliable. And so it causes a sense of dizziness or a fall, an imbalance, which is visible to many. And then the other thing, so dizziness on movement, we call it motion sensitivity. And some people will find just from head turns, they feel unbalanced or dizzy, from trunk movements, from picking something up to the floor, from reaching up high. So tasks that we do all day long in daily life. And if then you become worried that them tasks are making you dizzy, the problem then becomes that you do them less normally. And so my job as a vestibular physio and all the other physios that train in these conditions would then be to encourage you to do them tasks in a graded way so that you become less dizzy doing them. Your brain, like we said, is very clever. So it can basically then adapt and learn that then movement shouldn't actually make you dizzy. So if you have got an imbalance, we often say that rarely does it go back to 100% both ears, but your brain will then learn to work with the new normal. And that's called vestibular rehabilitation, which I'm going to come on to. So there's lots of good videos again online. Bppv is the Association of Chartered Physios interested in vestibular rehabilitation. So part of the Chartered Society of Physiotherapy, a subgroup of that. They have lots of good resources if you're a healthcare professional. And if you're a patient, there's VIDA, the Vestibular Disorder Association, that has lots of information about vestibular impairments and vestibular rehabilitation. Dizziness can be caused by lots of things, I should say, especially in the elderly population. So medication side effects, or taking a lot of medications that all interact with each other potentially. So that's something, if you're getting dizzy and it doesn't sound like an inner ear problem where it's on movement, or it's causing imbalance as well, or it's very positional, so getting out of bed, rolling in bed, looking up, looking down, then that you definitely need to discuss that with your GP or your local community nurses. Also, another thing that's very common is postural hypotension. So that can be from getting up out of bed, but it's normally from sit to stand, for example. And as you stand up and maybe start to move around, the dizziness comes, and that's from when your blood pressure drops. So again, it's a medical cause of dizziness that needs treatment often. So, evidence, lots of research has been done into vestibular rehabilitation and how it can help. And as I said before, the tricky scenario with vestibular rehabilitation and dizziness rehab is that often the exercises are designed to make you feel a little bit dizzy. So if you do feel like you have a vestibular problem, the best route is to talk with your GP or a community physiotherapist, a private physiotherapist with an interest in vestibular rehab, or potentially access your local ENT department through your GP, and they will design a program for you. If you think it's quite basic, there's some things you can try, but I would tend to recommend that you have an individualized assessment for yourself and then an individualized treatment plan that's joined together to work on the things that trigger your dizziness, because that tends to have the best effects. But there is some good evidence for just simple vestibular exercises. So as you can imagine, they're ones where we need to get your eyes and head moving. So a very common one would be something like this, and you would be encouraged to stand up and move your eyes to look between the two crosses. So you'd be literally looking side to side to side to side between them two crosses. And you might, if that was easy, progress to marching on the spot, looking at two different objects or them crosses. The further away they got, the more challenging, but that helps with people when they're turning. And you might also be asked to do it in a vertical manner, so looking up and down at two different objects, again in standing or marching on the spot, or standing on an unstable surface like a sofa cushion. The other one that's very common in vestibular rehabilitation is what we call gaze stability. So it's something that should be in all of us, our vestibular ocular reflex. So that's our inner ear system working with our eyes, so that if we look at something, we can keep our eyes still on it while our head is moving. Okay, so you could try it now. You could keep your eyes on that B and then turn your head side to side, seeing if you can keep that B still in focus while you're moving your head. And as we age, that becomes more difficult, but with any vestibular condition, particularly labyrinthitis or vestibular neuritis, it becomes really challenging. And so this exercise is designed to help your brain recalibrate and work out how to keep your gaze stable again. And you can again do it in sitting, standing, marching, walking, all the way up to getting it back into normal life tasks. So the key really is to enhancing and optimizing your vestibular function, particularly around our Stop Falling, Start Living campaign this week, Imbalance Awareness Week. So in order to keep your vestibular system healthy and primed and ready for action when you're moving quickly, it does like them quick movements. So we naturally slow down as we age for many, many reasons, but try and keep moving at your normal pace, especially things that are safe. So sitting down and moving our head a few times side to side or up and down, and then working on that when you're moving around, emptying the dishwasher, for example, or washing up. All of these tips that I'm giving you, obviously safety is the key. So do it near support services, when someone else is around, and within your own limitations. When you're out and about, try not to walk and fix your vision on something in front of you like a lamppost or a post box and walk towards it looking at it. Try and enjoy the scenery and look around, move your eyes, move your head so that you're using your vestibular system as you're going out for your daily walk. Try to walk on some uneven grounds when it's safe to do so. So grass, sand, thicker carpets. Because that helps your vestibular system work. When we're on very flat surfaces, we rely much more on our somatosensation, so our feeling in our feet, in our muscle spindles, in our muscles. But we want that vestibular system to keep functioning optimally, so uneven ground is good for that. Practice looking around, like we said, just even in your house, when you're moving from the chair to the bathroom. Don't just think, right, I'm getting up and keeping my head and body really still and I'm walking to the bathroom. Think about loosening up and looking around and trying to move more normally like you did in your younger years. Having a dance, that's always a good one because we tend to bop our head. Okay, and then other ones, more specific. You can find videos online for them. I always think it's better to have a physiotherapist supervising you when you're doing these exercises. Often, if you're referred for balance rehabilitation, vestibular rehabilitation will make up a part of that. So things like balancing on a sofa cushion with your feet apart initially and looking around, then maybe moving your head, then popping your one foot in front of the other and maybe trying to hold that on a cushion. And even up to standing on one leg and on a cushion if you're able to. So typically, things that are really promoted for falls prevention, such as Pilates, yoga, are all on very flat surfaces. So this just enhances that vestibular system a little bit more by doing it on a balanced mat, a rolled Pilates mat, a sofa cushion, which will just challenge your core strength, but also your vestibular system much more. And so finally, as we've talked a lot about the vestibular system, if any of these ring true to you, you think, oh, maybe I've got something going on in my inner ear. Most of the time, it's treatable and not serious. And actually, if you catch it early, good rehabilitation can get you back to functioning as well as you were before. So think about the Bppv. It's so common and so missed in falls prevention. So if you're getting short episodes of vertigo, getting in and out of bed, when you're looking up, when you're looking down, when you're rolling, that leaves you then feeling groggy and underconfident and off balance, it can be treated. Get it treated. Look on the internet for Bppv, the Eppley Maneuver, or Grant-Daroff exercises, which basically mean that you're sitting on your bed, rotating your head and lying down and holding, and then coming back to the middle, rotating the other way, lying down and holding. And they're designed to move them crystals back to where they should be and have a really good success rate. If you're thinking that maybe you've got a condition that predisposes you to vestibular problems, such as a central nervous system condition, MS, or you've had a previous stroke, and you feel, I am quite reliant on my vision, especially when it's dark, I become very underconfident, very wobbly, or I don't really go on uneven surfaces, your brain is very clever, and doing some specific exercises that your vestibular system's then awoken by will really help you in them scenarios. As we talked about, the labyrinthitis. So most people recover really well from a labyrinthitis episode, but lots of research is saying that it then leaves you quite visually dependent. So when you go into crowds, supermarkets, when there's patterned flooring or railings or the trees are whooshing around you, that can then make your symptoms feel like, or you feel a bit uncomfortable, you feel a bit dizzy, you feel a bit off balance. And all them can be treated with some specific vestibular exercises. I think that's probably the main things that I want to say. I hope you've enjoyed listening, and thanks for letting me spread the word on the importance of the vestibular system in falls prevention, but also how maintaining a healthy vestibular system and balanced system can really help you longer term. Have a nice day, everyone, and enjoy the rest of Stop Falling, Start Living programme. Thanks very much.